Hi everyone, and thanks so much for tuning into the show. I'm Stacey Holland. Now, the Real Health Medicine Cabinet is a feature where the Real Health team and I go out and we try some of the most popular natural products on the market. And then we invite health experts into studio to give us more insight into these products and the conditions that they're good for. So we went looking for the best treatment for varicose veins, and we found a very good natural supplement. But first we have in studio Dr. Werner Kerschbaumer to shed some light on the topic. I know many ladies will be very, very happy because, for some of them, it's just the bane of their existence. Varicose veins, how do we get rid of them? Where do they come from?
Sure. So let me maybe start with what they actually are. Varicose veins are just the swollen, enlarged blood vessels, the veins that we see in our legs very often, mostly around about the knee and lower down the feet.
Yes, on our calves.
Legs,
the parts of our legs that we want to show off.
Exactly. And they happen because of the connective tissue in the blood vessels getting a little bit weakened over time. Many things can contribute to it, but the connective tissue gets weakened, and then if you do stand a lot or walk a lot because of gravity, the pull of gravity, and because of the weight of the blood pulling down, the valves within those veins can become weakened, and then blood pools in those veins and they become distended. Yeah.
Some people say it's just genetic, it's hereditary, there's nothing you can do about it. What's the research showing us?
Yeah. Look, it can be hereditary. Genes certainly do play a role, but I'll use my family for a good example.
Okay.
My dad has terrible varicose veins.
Okay.
He actually had to have surgery for it.
Wow.
And all of us then, if it's genetic, should have the same situation. Only one of my brothers have, and we're 8 kids. So
that's where epigenetics plays a huge role.
Yes, it certainly can be a predisposing factor.
Yes.
But it's not necessarily that it's the thing.
Yes.
But then it could be that genetically your connective tissue is weak.
Okay.
And then if you do other things, for example, if you have a job where you're sitting a lot, or if you have bent legs a lot that you're not actually moving, then of course those genetic predispositions will be problematic for you, and it can cause the veins to distend.
Okay, and the difference between varicose veins and spider veins?
So the varicose veins are basically your larger veins, but spider veins are just the small venules in the skin. So the varicose veins are actually under the skin. They're not in the skin the skin itself. Whereas the spider veins are in the skin itself, and it's those fine, small little thread-like veins that you see. Small, tiny veins. Sort of make sort of a web. That's why it's called spider veins.
Spider veins. Besides people that are sitting and walking a lot, besides people that know that they have it, running in their family, who else is at risk?
It's most common in females.
Yeah.
All right, it's just the way it is. And part of that has to do with the hormonal changes.
Okay.
It's thought and understood that those changes in the hormones, pregnancy, the cycle, menopause, they have an effect on the weakness or the structure of the connective tissue within the vein, so it predisposes to it. The other things like, being too passive, sitting at a desk long, those sort of things, they're all predisposing factors. But it's very difficult to really show total risk.
Yes.
Because you don't know whether you're going to get it or not.
That's true. And what can people do about them? I've heard some people say they're quite painful.
They can be very painful. It's a really pulling down feeling and causes swelling in the legs and swelling in the feet. So it really can be uncomfortable. And it can even lead to infections and ulcers on the skin, etc. So it really can be a serious situation.
Okay.
It can lead to eczema, dermatitis, all those sort of things happening in the legs because of, if you have the blood pooling there, the microcirculation is also affected. So you don't get good oxygenation to the tissues, and you also don't get good removal of toxins and waste products from the areas. So it's really a snowball effect. But what people can do, number one, things that can contribute to it that I didn't mention, I should actually have with the risks, being overweight, obesity, diet, nutrition certainly can play a role. So if you look at those things, lifestyle changes, smoking cigarettes, drinking alcohol, all those things can play a role in developing them. So certainly if you reduce that, if you already have varicose veins, it should have an impact. It's not going to get rid of them. Getting rid of them is almost impossible, because once the damage is done, the damage is done.
Really?
But you certainly can reduce the progression or reduce the effect of it. The only thing that really truly gets rid of them is surgery if it's bad.
Let's talk about some preventative measures as well. If someone does know they're predisposed to it, or if we're watching and we just want to make sure that we don't end up developing varicose veins, what are some measures that we could take?
It all comes back to the same lifestyle things that you want to do to try and stop the progression, etc. Exercise properly, get good exercise. Try, if you are at a job where you are sitting behind a desk very often or kneeling a lot, those sort of things, make sure that you do exercises while you're sitting. For example, if you are on the plane, you do the calf exercises to make sure that the calves are pushing the blood through the veins back to the heart. So those are things you can do. Certainly nutritionally, you've got to do those things.
What are you doing nutritionally? Because is it linked to circulation? Is it linked to the integrity of the walls? You know, and perhaps maybe you can sort of shed some light if it's happening in your legs, what other parts of the body would the integrity of the venous walls be then compromised?
Look, it might be through the whole body. But you've got to understand that, for example, in the brain, you don't have gravity having a huge effect on keeping the blood down there at the bottom. Your legs are very far from your heart, so it's very tough for your heart to push the blood through if the valves are leaking. So you don't have that effect in the rest of the body, so to speak. So even though it might be there, you wouldn't have it to the same extent.
What about compression wear? You see compression socks, and you know the elderly like to wear stockings or compression leg warmers and things like that. What does that do?
So it helps to compress the tissues to help the veins so that they don't distend as much, all right? However, if you wear tight clothing, it can also predispose to actually developing varicose veins.
Because there's a difference between tight clothing and compression wear, right? Okay.
Yes.
So the one supports and the other one constricts.
Correct. The one totally constricts and it can actually cause the pooling of blood, whereas the other one is actually elastic enough to support the tissues around it, but cause pressure on it so that it almost helps the veins or the valves to close and the muscles to push the blood more effectively.
Are there any other types of tips that you've come across?
Elevation certainly helps.
Important.
It's a very, very important thing. It certainly will help, especially in summer. Many people will find in summer that it's exacerbated a lot. For the rest, the compression, massage certainly can help, but it's not muscular exercise. It's what is called effleurage. So it's a sweeping type of massage which helps the fluids
like when you do a lymphatic draining type. Yes. Okay. Well, the Real Health team tried Go2 Cola, which is a natural supplement that helps to improve peripheral circulation and therefore varicose veins. So Dr. Werner is going to give us some insight into what makes this product so unique. Let's chat a little bit about peripheral circulation, because obviously when you think about what's happening, the first thing that springs to my mind is it hampered circulation? Do we need to improve circulation? Obviously there are foods that could help with that, and then we'll get to the supplement as well.
So peripheral circulation is actually the circulation that goes to your skin, etc. So if there's weak connective tissue in any of those areas or any of those regions, yes, it can lead to varicose veins.
How does Go2 Cola help with that? What's research showing us?
So quickly, I mean, it's a weed that grows in our lawns. It's not that common in Gauteng, I believe, but in Cape Town, where I'm from, it's quite common. It's that little round kidney-shaped leaf that just grows in between your lawn and causes havoc. But it actually has some actives in it, which is called triterpenoids, all right? And those actives have been shown to have an effect on collagen, amongst some other things. But collagen and the connective tissue is what we're aiming at when we're looking for improvement of varicose veins. So it actually helps at that level.
In fact, I read that many people that took products for varicose veins found that their cellulite improved. And this is the reason why, obviously, is because that impact on connective tissue as well. Okay, so, I mean, the dosage in this, is it quite safe to take on a regular basis? If someone has varicose veins, is this something they're going to be taking indefinitely?
Look, use it for about 12 weeks, but then take a bit of a break. A week or so. And that's simply because all herbs have pharmacologically active substances in them. So they get processed by the liver and the kidneys. So you need to give those organs a chance to actually get rid of biological material. So just a short break. There's just one risk that one does need to be aware of, and that is people who have liver disease or people who take other medications that might be what is called hepatotoxic. In other words, have an effect on the liver also. If they take any drugs that are affecting the liver, they should be careful with it. Theoretically, there can be an additive effect, but it's theoretically, so better safe than sorry.
Then sorry, obviously then seek the help of a knowledgeable practitioner, as we always say. What else does it help with besides cellulite?
So, you know, if you go and do a bit of a Dr. Google search, you're going to come up with a whole wad of all sorts of things, from diabetes right up to you name it. But in reality, if you look at the science, there's significant science to be able to say that it can help with wound healing because of the collagen support.
Yes.
Absolutely.
Yeah.
There's certainly some indication that it could potentially help people with diabetes because, again, it has an effect on the circulation, which is a huge problem for diabetics. Those are the major things. Yeah.
Fantastic. Well, thank you so much for joining us. Before I let you go, where do we find it?
Oh, health stores, pharmacies, discounts, those sort of places.
Fantastic.